Get ready for some after-holiday fireworks in Washington. Next week, Congress returns from summer recess to consider once again health care reform, the #1 issue for the White House. But Republican opposition is fierce, which is one reason why on Wednesday, President Obama addresses a joint session of Congress on that issue. Joining us now to discuss what happens next is Reinhardt, a professor at Princeton University. He specializes in the economics of health care. Professor, welcome to Bloomberg News.
Happy to be here.
Professor, is this a turning point for President Obama? How is he going to sell this with the opposition being so fierce, as I just mentioned?
Well, it is a turning point, and he has to sell it, or whatever he wants to still sell. I think the entire package was huge and couldn't possibly have done in any 1 year anyhow. The whole issue of structuring cost containment, information system, all that takes a lot longer. But what he can't sell is the idea that more Americans should get help to get private health insurance or public, although I'm not sure the public plan will survive this.
You don't believe that these negotiations that we're hearing about between the president and the Maine Republican Senator Olympia Snowe are going to bear any fruit? There had been talk that there would be a compromise where the public option would not be part of an initial health care reform, but might be something that could be considered later.
I think that is, in fact, a smart approach, because putting a public plan in place would take quite a bit of legislating and organization. And one should perhaps say, let's give the private insurance industry a chance, 3, 4, 5 years, see what they can do in this respect. After all, if you look at the website of the private insurers, they have come forth with all kinds of ideas of how they could make insurance more accessible. And if that fails, then you can have as a fail-safe a public plan. I think right now that's probably the cautious and pragmatic approach they should take.
Dr. Reinhardt, Lori Rothman here. In recent writing, you suggest the administration look at 2003's Medicare Modernization Act. Why is that?
Well, because as a baseline, the president could certainly open up saying, in that year we passed a huge entitlement, which will cost the not the taxpayer, but the deficit, which will increase the deficit between 2010 and 2019 by $1.2 trillion. And the President Bush and the Republican Congress didn't finance it at all. They just added it to the deficit. So the president starts with that as a baseline and can say, at least we in this reform are trying to finance it by raising taxes a little bit and cutting back on health care spending in existing public programs. Simply just to take the wind out of the sail of the critics who say he's just adding to the deficit. He hasn't yet, but there's no question President Bush did big time.
What do you think, then, is the best way to finance health care reform? In that article, you said that the earmarked sales tax may actually have a decent possibility.
Well, I had thought one idea might be to give everyone a stake in health reform is to have a small sales tax, maybe 0.5% on all retail sales. It's about $8 trillion. That would raise pretty much about half of the money he would need to finance health reform, and the rest could be gotten. Over 10 years, you should be able to cut out some fat from the Medicare program, not Medicaid so much, but Medicare and other public programs. So It seems to me, rather than, it's not taxing the rich is a good sport, but I think it always is so divisive. If everyone paid a little sales tax, which wouldn't really hurt them, then you could say we're all in this together.
Professor Reinhardt, we have about 30 seconds left. What about this idea that's being floated around to allow people to buy into Medicare?
Well, of course, for people over age 55, if the private insurance industry cannot accommodate them, and fairly quickly with this recession on us and high unemployment, you could allow them at least temporarily to buy into Medicare at actuarially fair rates, then maybe have Medicare pay hospitals 115% of regular Medicare fees so the hospitals don't get hurt. I think that could be done. maybe you could, again, on a temporary basis, if the private insurance industry can handle it, maybe then later you could put it there.
Professor Uwe Reinhardt of Princeton University talking healthcare with us on Bloomberg. Professor, thanks for your perspective. Appreciate it.
My pleasure. Go to the beach.
Thank you, sir.
You too. We're right behind you.